The following is a commercial program paid for by these sponsors. The opinions and views expressed belong to its sponsors and are not those of Nexstar Broadcasting, Inc., this station, or their affiliates or employees.
Jefferson County Sheriff Mark Petway has made it his mission to improve Jefferson County by bridging the gap between law enforcement and the community. Community initiatives are awakening dialogue and forming relationships between deputies and the communities they serve. It's this bridge that helps better serve people and families dealing with mental illness.
That is a top priority of the Sheriff's Office. We want to make sure that we help them and their families during those times of need. And we want you to know that we're there for you.
Mental Health Matters is presented by Children's of Alabama.
Having an open discussion about mental health is more important now than ever before. With all of us navigating our new normal during this global pandemic, it's crucial that we nurture our mental health as well as our physical health. Hi, I'm Lillian Lalo, host of Living Local Content for CBS 42, and I'm so happy you're with us today. I've sat down with representatives from Children's of Alabama, the Jefferson County Sheriff's Office, the Crisis Center, and the Mentor Program. Each organization shares important and relevant mental health information that you can use today or remember for any future need that involves your mental health or someone you love. Mental health can be a dark topic, but I want you to know that we've written this show with the intent to provide open and honest information about mental health while keeping it suitable for everyone to watch. So if your kids are in the room, that's okay. Mental health matters for every single one of us. Speaking of our children, let's talk about their mental health. We spoke with a licensed professional counselor from Children's of Alabama who tells us about a fantastic free resource for finding the best mental health services for your kids.
Mental health is real and it affects everyone at different levels. And it's very important to know that when your child needs help, that acting on that is the right thing to do.
Cindy Jones is the director of the Pediatric Intake Response Center for Children's of Alabama. It's also referred to as the PIRC. If your child is experiencing more stress than usual right now, Jones wants you to know that you're not alone.
What we've seen is a lot of kids that are in distress, overwhelmed, frustrated, depressed, anxious. So many people feel that way right now because of the pandemic, but what we're seeing is it's more chronic and it's more profound in the kids that are presenting to us. So many right now are experiencing a lot of depression and anxiety because they feel hopeless, they feel like things are out of control, and they're not sure about the future, and so that creates a lot of distress. And if someone already has an underlying mental health concern, that's only going to exacerbate it even more.
The Psychiatric Intake Response Center falls under an umbrella of children's behavioral health services provided by Children's of Alabama. The PIRC is essentially a call center that allows adults who are looking for mental health resources for children and teens to find mental health resources in their communities. Think of this service as a navigation system.
And so we basically take the legwork out of it for them and allow them to be able to contact us, tell us what's going on, let us know what their concern is, and allow us to match them with the appropriate resource. And we ask them to call those resources and those providers, and if it doesn't work out, they can give us a call back and we'll help them explore other resources. Anyone can call us. So it may be a parent, a grandparent, it could be a teacher, a school counselor. We get calls from pediatricians, nurses, law enforcement, anyone who is looking for resources for a child or teen that needs some mental health support. We ask questions like, what is the concern that you have? Is transportation an issue? What type of insurance do you have? What are you interested in seeking for your child? And sometimes the answer is, I don't know. And so what we do is we kind of talk through that and we say, okay, we understand, let's talk through it more, and then we can find out exactly what it is you need.
The PIRC will match the child with a psychiatrist, psychologist, social worker, or counselor, any resource that would be beneficial. Jones says that periods of transition can be sensitive times where mental health support can be helpful for your child.
So we're talking about children that are maybe going from elementary school to middle school to high school to graduation. That's when that anxiety or depression can increase.
Mental illness affects children of all ages. Sometimes depression and anxiety can come out in the form of anger or unexplained physical ailments.
A lot of younger children will have a lot of physical symptoms, and even older children as well. So if you have like headaches and stomach aches that don't seem to have a reason for it, those are times when you're looking at it going, well, maybe what's going on? Maybe what's my child trying to tell me? You can notice a lot of mood swings, and these are more than the normal. So kids do have days where they're more moody than others. We all do, but this is something that you're noticing more often and is kind of unexplained. So you're wondering, why are they reacting like this when they normally would not?
The time to seek help is if you notice a pattern of warning behaviors for more than 2 weeks.
Some kids have bad days like we all do, and that's okay. But what you're looking for are symptoms and signs over a period of time and that are progressing. Right now, kids are maybe in their rooms and they're spending time away from their parents because they just need a break, right? Because you're in the house a lot together already. Well, what are they doing in their room? Are they interacting with social media and their friends, and that's how they're connecting socially? Or are they in their room and it's dark and they're quiet and they're disconnected socially? And that may be a sign of depression and anxiety.
Other signs of mental health distress could be increased clinginess, poor sleep, poor hygiene, and loss of attention to their overall care.
They may be self-harming or expressing thoughts that they want to harm themselves or someone else. And so these are real signs that a child is in distress and that there's a concern and you want to reach out. Call the PIRC first, because we might be able to direct you to the appropriate resource. And in those cases, sometimes it may be, here's an outpatient provider that can help your child, or maybe that child is in so much distress they need to go to the emergency room.
Jones says it's better to be preventative than reactive.
Don't wait for a crisis to occur. It's really important to go ahead and act pretty quickly. People are not going to the doctor because they're trying to avoid places that they might be exposed. But if you have a mental health provider, you want to continue that relationship. And if you don't, you may want to go ahead and establish that relationship and keep it and keep those appointments.
While seeking mental help can feel stigmatized, Jones says that society is changing and recommends not worrying about what other people think.
The more important thing is that you help your child be successful in life, and doing that means getting the proper care. You would do that for a medical concern. You want to do that for a mental health concern. This could be life-changing for your child. If they get the help they need and the intervention, this can make all the difference in the world.
Jones suggests keeping a routine for your kids. She says structure, like they might receive in school, is very comforting and can ward off depression and anxiety. Check in on your own mental health, too. If you feel good, it can help your child feel a sense of security.
If you are able to be that positive light in your child's life, it can make a big difference. If you as a parent are struggling to do that, that may be when you need to seek mental health care for yourself, because your child is taking cues from you as to how to handle a situation. What I would say to a lot of parents is listen more and affirm. Think about what you need as well. We all need to be heard. And so if you can do that for your child, it can make a big difference.
Earlier this month, Children's Behavioral Health opened a partial hospitalization program. This is an intermediate level of care.
The community's been asking for this program for a long time. It's a sort of a step down from inpatient and a step up from outpatient. So you're going 5 days a week. So you're seeing a therapist every day. You're seeing, a psychiatrist once a week. And it's a program that allows you to really focus on recovery.
Anyone can call the Psychiatric Intake Response Center. The number is 205-638-7472. That's 638-PIRC. The resource is open from 8 a.m. to 11 p.m. every day of the week.
This allows anyone to give us a call when it's convenient for them. We ask them to just pick up the phone and give us a call.
Coming up after the break, Sheriff Mark Petway with the Jefferson County Sheriff's Office opens up about how his deputies are trained to handle mental health calls. Stay with us.
Mental Health Matters is presented by the Jefferson County Sheriff's Office.
Jefferson County Sheriff Mark Petway has made it his mission to improve Jefferson County by bridging the gap between law enforcement and the community. Community initiatives are awakening dialogue and forming relationships between deputies and the communities they serve. It's this bridge that helps better serve people and families dealing with mental illness.
That is a top priority of the Sheriff's Office. We want to make sure that we help them and their families during those times of need. And we want you to know that we're there for you.
There have been a lot of changes the past few weeks due to the coronavirus pandemic, and we have made many changes here at Children's of Alabama. Some changes include everyone wearing masks. Waiting areas have been reconfigured to provide for social distancing. Visitation limitations are in place. As always, you can count on Children's with confidence, still here for your child, just like we have been since 1911.
Mental Health Matters is presented by the Crisis Center.
Welcome back. In our next story, Sheriff Mark Petway explains how his deputies are trained to respond to mental health calls and offers advice for family members who have a loved one that experiences mental health struggles.
Sheriff Mark Petway says that he's committed to helping those who are affected by mental health struggles.
It is a top priority. It is something I campaigned on. We want to make sure that those that have mental health issues get the best care, and we're there to help them during those times.
Petway says that his deputies will receive calls when a concerned family member notices a loved one is not taking their medication or their medications are not working.
So what we do, we respond to those calls and we try to make sure that we can restore peace in those situations.
Sometimes deputies have to arrest someone, which the sheriff says they really don't want to do. Instead, they prefer to take the patient to a mental health facility.
We would love to use Cooper Green or UAB Metro West as a place for alternative to take those that have mental health issues instead of bringing them to the jail.
Those who work with the JBS Mental Health Authority will often assist deputies on mental health calls to help facilitate taking a patient to a mental health facility.
JBS has everything that they need to be able to help those with mental health issues.
At the academy, all deputies are trained on best practices when responding to mental health calls.
We try to give them the best training as much as possible to deal with those individuals and to be able to also mark their place of residence, because sometimes we have to return back to those places because of those individuals. The radio operator will say, hey, this house has already been flagged as a person with mental health issues. They may give out the name of that individual, and so the deputy will know how to react once the deputy is there because of information that was already put in the system. We do listen to what the family members are saying because they know the history of that individual, and that's always helpful there to be able to hear the history of an individual. And a lot of times the family members will let us know that, hey, once they get their medication, they're a different person.
I asked Sheriff Petway what you should do if you're in a situation where you fear a family member is off their medications and it's only a matter of time before they hurt themselves or someone else. Petway urges you to talk to the probate judge about getting a commitment order.
Once a judge gives us that petition to pick that person up, we will pick that person up and transport that person to where they can have a bed until the judge fully hears the case. So that is the best way for us to operate in a situation like that. And that is in cooperation with that family member who loves their family. And they want to make sure that their family is treated properly, and that's what we're there to do. My commitment to those that have mental health issues also involves bridging the gap. And that is something that we do with the community. It involves the community. We let them know that we're just not there to make an arrest, but we're there to help. So we're bridging the gap by extending a hand, saying that we're partners in this together.
Coming up after the break, you'll hear from the Crisis Center. Call volume is up, and they're looking for volunteers to help. More information when we come back.
Mental Health Matters is presented by Grandview Medical Center.
Jefferson County Sheriff Mark Petway has made it his mission to improve Jefferson County by bridging the gap between law enforcement and the community. Community initiatives are awakening dialogue and forming relationships between deputies and the communities they serve. It's this bridge that helps better serve people and families dealing with mental illness.
That is a top priority of the Sheriff's Office. We want to make sure that we help them and their families during those times of need. And we want you to know that we're there for you.
There have been a lot of changes the past few weeks due to the coronavirus pandemic, and we have made many changes here at Children's of Alabama. Some changes include everyone wearing masks. Waiting areas have been reconfigured to provide for social distancing. Visitation limitations are in place. As always, you can count on Children's with confidence, still here for your child, just like we have been since 1911.
Mental Health Matters is presented by the Jefferson County Sheriff's Office.
When the global pandemic began this past spring, calls to the Crisis Center doubled. That's about 4,000 calls a month. This according to the center's executive director, Meg McGlamory. In this next story, she shares information on services the Crisis Center provides, as well as ways you might be able to help.
For the past 50 years, the Crisis Center has been a safe place for people to turn when experiencing a personal crisis or mental health struggle.
We are there 24 hours a day, every day of the year. So even through COVID-19, there is somebody there to answer the calls. What's so strange about this time is we're in it together, yet we've never been so alone. So all of us are going through this together. We're in this crisis together.
The center is home to 3 main divisions: suicide intervention and prevention, sexual assault response and prevention, and substance abuse help and support.
We respond without judgment and with unconditional positive regard. So no matter what the problem is, no matter how small, how big, we take everything very seriously. None of us are immune to crisis at all. So we look at people on social media and think they're doing great, but because of the stigma about personal crisis and mental illness, we may never know.
McGlamory says the center's goal is to connect people to the right resources so that they can start healing.
So we always like to say, hear, help, heal. That's what the Crisis Center is all about.
If someone comes to you in crisis, McGlamory says the best thing you can do is listen and hear them.
They have trusted you with this information, and it was really hard for them to come forward to tell you. So acknowledge that courage, acknowledge that strength. And if they're open to it, suggest calling the Crisis Center. If they're not open to that, we really suggest that the friend ask if it's okay if they make the call with that person on the line. And if they're not willing to do that, the friend can call us directly and just tell us what's going on, and let's see what we can do to help.
Be aware of warning signs that a friend or family member may be in crisis.
If they start to isolate themselves, if they talk about wanting to harm themselves, if they say that they feel like they're a burden to their family and friends, those are all signs that something could be going on. And what we tell everybody is to trust your instincts, no matter what. And, make that phone call. So I'm so glad that we're putting focus on mental health right now during this important time, because there are people who are really hurting and need to see this.
Because call volume has increased drastically, McGlamory says that the need for volunteers has increased. Volunteers can work from home to answer calls and online chats through an anonymous computer system.
Our shift managers are there listening to the calls to help out if anybody needs any additional help.
Visit crisiscenterbham.org to apply for the volunteer program.
We will make sure to be with you every step of the way in learning how to do this and do it the right way.
If you have a servant's heart, you may also be interested in hearing about the Jefferson County Sheriff's Office chaplain team. They're an all-volunteer-based unit. Those details after the break.
Mental Health Matters is presented by the Mentor Program.
Jefferson County Sheriff Mark Petway has made it his mission to improve Jefferson County by bridging the gap between law enforcement and the community. Community initiatives are awakening dialogue and forming relationships between deputies and the communities they serve. It's this bridge that helps better serve people and families dealing with mental illness.
That is a top priority of the Sheriff's Office. We want to make sure that we help them and their families during those times of need. And we want you to know that we're there for you.
There have been a lot of changes the past few weeks due to the coronavirus pandemic, and we have made many changes here at Children's of Alabama. Some changes include everyone wearing masks. Waiting areas have been reconfigured to provide for social distancing. Visitation limitations are in place. As always, you can count on Children's with confidence, still here for your child, just like we have been since 1911.
Mental Health Matters is presented by the National Center on Health, Physical Activity, and Disability.
Welcome back. Before the break, we shared information on volunteering for the Crisis Hotline. We also want to share another opportunity that comes from inside the Jefferson County Sheriff's Office.
This is the Jefferson County Chaplain Team, a diverse group that comes from all faiths. Some are even bilingual.
We have chaplains of different faiths to be able to serve the whole department and the community that's here, the community as a whole.
The chaplains are made up of an all-volunteer unit within the Jefferson County Sheriff's Office. Their goal is to meet the emotional and spiritual needs of employees within the Sheriff's Office, as well as citizens after a disaster or personal life event.
The chaplain team, they are very big help to me. They assist me with my duties here at the Sheriff's Office to make sure that all my employees have someone to talk to in case of a tragedy. They can minister to you. They understand, and they're willing to sit down and go the total mile with you.
Volunteer chaplains are carefully selected and trained. If you're interested in joining the chaplain team, visit the chaplain program page on the jeffcosheriffal.com website. For our final story, we want to highlight a collaborative program with UAB, the Lakeshore Foundation, and the National Center for Physical Health and Disabilities. Physical, mental, and emotional health is fostered through their Mentor program. Mentor stands for mindfulness, exercise, and nutrition to optimize recovery. The program focuses on individuals who have acquired a new disability, diagnosis, or have a congenital condition. Dr. Jim Rimmer has more.
Mental health matters? When didn't it matter? I mean, mental health has been the bane of our existence for centuries. John Milton, one of the greatest English poets, said, "The mind is its own place, and in itself can create a heaven out of hell or a hell out of heaven." So everything is controlled by our mind.
And there are two easy ways all of us can improve our mental health, and neither cost a penny. Dr. Rimmer recommends spending green time over screen time and engaging in joyful movement.
There have been studies to show that you need at least 2 hours a week in the outdoors, around green space, around trees, flowers, plants. We need to be back to nature in order to improve our mental health. When you return to that element of life, mental health goes through the roof. it improves markedly. Movement is a very, very important part of optimizing your health and well-being, and also your mental health. There are many studies, dozens of studies, that have shown it reduces depression, it improves, anxiety disorders. The biological effect of movement is astounding. Just getting circulation, blood flow, higher rates of blood flow to the brain, create something called brain-derived neurotrophic factor, which is a chemical that improves cognitive function. It improves the transmission of impulses from one part of the brain to the other. It really does lend itself to improving, probably in more than any other wellness area, very high levels of mental health.
For people living with a disability, in some cases, it can be difficult to spend time outside and engage in movement activities. In comes the Mentor Project, funded under the CDC grant NCHPAD. NCHPAD traditionally focuses on building inclusive community organizations and networks to make facilities and programs more inclusive to people living with a disability. The 8-week Mentor program works directly with people with disabilities.
And the goal of Mentors really, it's a perfect time now because of the pandemic, but it's to reach people with disabilities in their home, where we described earlier that there's a tremendous level of social isolation, loneliness, depression, anxiety. Many people with disabilities are having trouble getting personal care assistance to come in and help them because of the pandemic. And so they're losing a lot of the critical services that they need, and that's increasing their stress and depression. Ment is really meant to get to the heart of what we need to do as a society, and that is to really look at the body, the mind, and the spirit sort of interactively, to get people at a place where they understand there's a lot more to life than what they may see. In fact, in some respects, it's what you don't see that could be the most critical element of your portal to health, and that's the spirit.
The program was originally designed to be done in person, but because of the pandemic, it's been moved almost exclusively online.
Now we're actually delivering the program right into their home, and it's a great way to reduce that social isolation. Even though it's virtual, it's still much better than being completely isolated.
At the end of the program, participants come away with new life skills and a $200 gift card. Do you think you could benefit from the Mentor program or know someone that could? Or maybe you might be able to help the program grow. Consider getting involved.
Anyone who wants to be part of the movement just needs to contact Lakeshore, and we'll figure out a way that they can get, they can have a role using the talents that they've been born with in order to reach more people in our community. Let's make Birmingham the most inclusive society and city in America.
We hope you've enjoyed our Mental Health Matters special. We would like to thank all of the organizations that participated, each based in Alabama, but with reach and influence that goes far beyond our state. You can help us spread their important mental health messages by sharing this story with your friends and family. We have the full show published on CBS42.com. We're all traveling this path together. Remember to nurture your mental health along the way. For CBS 42 Living Local, I'm Lillian Lalo.
The preceding is a commercial program paid for by these sponsors. The opinions and views expressed belong to its sponsors and are not those of Nexstar Broadcasting, Inc., this station, or their affiliates or employees.